Good morning, and certainly good to have you with us on AM Singapore. The Gamma knife has made headlines lately for its ability to remove brain tumours. But little known is its other potential to treat diseases like epilepsy and Parkinson's. Well, to tell us about the varied uses of this cutting-edge technology is Dr. Prem Pillay, Head of Neurosurgery at the Singapore General Hospital. Thanks, Doctor, for coming in so early.
Thank you.
Briefly, how does this Gamma knife procedure work?
The Gamma knife is a revolution in surgery. It is actually computer-planned and controlled gamma rays which are focused onto any point within the brain to kill a brain tumor or to kill an area of abnormal blood vessels which have been the cause of stroke, for example. These indications are fairly well established. Over 30,000 patients have been treated worldwide in the last 20 years.
Main benefits? The
main benefits are that it's really a day surgery. You don't have to go through a major brain operation which would require a day or two in the ICU, 7 to 10 days in hospital, and the risk of death, infection or bleeding occurring because of the surgery. These complications do not occur at all with the Gamma knife.
So I take it that you don't even need to be prepared as you would in a conventional surgery, fasting and all that. It would be totally unnecessary.
Exactly. In fact, this is one of the major reasons why patients find it a very comfortable procedure. They come in the morning after having the dinner the night before and their breakfast that morning itself, and the procedure is done during the day, and in fact, if they need to wait and have it done in the afternoon, they can have lunch. And it takes about 1 hour to an hour and a half for the procedure. It's completely painless, and they can go home the same day and even resume work the next day if they so wish.
Oh, it sounds fantastic. But gamma rays are of higher intensity than our X-rays, and we know that X-rays have radiation effects.
Right.
This has been established. But so won't gamma rays have correspondingly higher effects?
Exactly. In fact, that's the reason for using gamma rays. But these are very carefully focused and carefully controlled in the way they come out from the machine. There are actually 201 of these gamma rays which are focused very precisely onto a point within the brain. So each gamma ray, as it passes through the brain on its way to the target, has minimal effects, doesn't cause any harm. But when they're focused and concentrated on one point, then it has its biological effect.
So this differs in terms of it's more concentrated, whereas the X-rays are not as focused.
That's right. X-rays are diffuse. And in fact, if you have standard radiation therapy, that's one of the reasons why your hair may fall and you get a sunburn effect on the skin, which you don't get at all with the gamma treatment.
So far, we know it's been very successful in treating brain tumours. But what does the current research point to?
There's a lot of research being done in several areas. One of them is Parkinson's disease. Another area is the treatment of epilepsy, particularly when it's resistant to medications. And finally, for severe pain, particularly if you have cancer pain, which is resistant to drugs. The gamma knife may be useful in these areas. Research is being done right now.
Now, you mentioned epilepsy, Parkinson's. These are neurological disorders.
That's right.
So how does this procedure aim to help?
Well, there are short circuits in the brain that occur in Parkinson's disease and also in epilepsy. And we can identify the particular box that's responsible for the short circuit within the brain. We can actually prevent the short circuiting from occurring by interrupting the signals by using the gamma knife.
How do you identify these areas, though?
That's very complicated. We need very advanced imaging techniques beyond just the magnetic scans which are being done for the brain right now.
So current
That's where the research is being done.
On the particular areas in the brain that you would have to kill the cells off.
Exactly.
You mentioned relief in pain-related, cancer-related disorders.
Yes.
Does that mean that this technology can be used in all types of cancers?
Yes, I think there's a lot of work being done worldwide, for example, in Stanford University, to apply this kind of technology for lung cancer, for liver cancer, for pancreatic cancer. But here we have a moving target. The brain is stationary. But when you have the lung, it moves as you breathe. So to hit a moving target is much more difficult. It requires much more sophisticated computer technology. But it'll happen within the next 5 years, I'm quite sure.
So there would be no cancers that would be left untreated?
That is correct, with using this technology. But there are limitations to the gamma knife technology. One of them, the main limitation, is size. If it's more than 4 centimeters in size, a little bit bigger than a golf ball, then this technology is not as safe as going for conventional surgery.
Why not?
Because the gamma rays then will have to be at a higher dose to be more effective at a larger size, and there can be spill-off of the radiation into the normal brain, causing side effects. So we don't recommend it at a size greater than 4 centimeters.
How familiar, Dr. Pillay, are Singapore doctors with this particular procedure?
Not as familiar as they should be, so we're holding talks and seminars to educate doctors in this technology.
And would there be a special criteria or a special type of training that they would have to undergo?
Yes, exactly. There will be special training and accreditation required for a neurosurgeon or another kind of a doctor, such as a radiation oncologist, to use the Gamma Knife.
What about side effects? I mean, what's the worst-case scenario that could happen?
I think one of the great benefits of Gamma Knife technology is there's no cutting open of the skull or entry into the brain physically. So there's no risk of death, bleeding, or infection, which are major risks of surgery. But that's not to say there are no side effects. Overall, the side effects are 1/3 that of surgery. And in about 5% of patients, there may be adjacent swelling in the brain that can occur sometimes 6 to 9 months after the treatment.
And chances of relapse?
Relapse meaning if the treatment is successful, we follow these patients on a yearly basis because in 10% of patients with tumors, the tumor could recur.
All right, 10%. Well, that's a very good figure.
Yes.
Dr. Pillay, thanks so much for coming in and explaining a bit more about Gamma Knife technology. And Dr. Prem Pillay is Head of Neurosurgery at the Singapore General Hospital. We turn now to look at the headlines in the regional papers.